Hi, this is an update on the COVID-19 vaccination program for Walker Street Doctors patients. We've been notified that we'll be receiving 50 vaccine doses per week for our patients from the 12th of April. I'm sure that we'd all agree that prioritisation of the distribution of these vaccines must be based on evidence. Increasing age is the clearest risk factor associated with poor outcomes from COVID-19, and the risk of severe disease and death also increases with the presence of multiple medical conditions, which also increases with advancing age. So we'll be prioritising our patients aged over 80 for the first week of rollout. We will personally contact them and make a booking if they choose to receive it at that time. This will be followed by our patients aged over 70 and others at statistically high risk of poor outcome. That is, specifically, organ transplant recipients, patients with leukemia, myeloma and lymphoma in the past 5 years, patients with other cancers diagnosed in the past 12 months or still receiving treatment, and any patients currently undergoing chemotherapy or radiotherapy. We'll also be contacting those patients directly to book an appointment in our COVID vaccine clinics from the 19th of April to the 22nd of May. From the 24th of May, we'll be opening up our online booking portal for the remaining patients in Category 1B, and that is those at moderately increased risk of poor outcomes when compared with the rest of the population. Specifically, those patients are those with ulcerative colitis, Crohn's disease, those who are on immunosuppressant therapy, those with rheumatoid arthritis or lupus, SLE, HIV, severe chronic renal failure, heart disease, diabetes, severe obesity, that is with a BMI over 40, chronic liver disease, chronic lung disease, including cystic fibrosis, COPD, and interstitial lung disease, stroke, multiple sclerosis, motor neuron disease, and Parkinson's disease. Also in this group are other healthcare workers who haven't received their vaccination at one of the hospital-based vaccination hubs. Specifically excluded from Group 1B are patients with osteoarthritis, those with mild to moderate asthma, fibromyalgia, chronic fatigue syndrome, mild to moderate renal impairment, and migraine. Those patients will be catered for in the Stage 2A rollout. I'm hopeful that this is a very helpful update and helps to align your expectations with the capability of both our government to supply us with the vaccines and our capacity to distribute them. For further information, I've found that the most helpful websites are the ATAGI, Australian Technical Advisory Group on Immunisation, healthdirect.gov.au, and NPS, the National Prescribing Service. Thank you very much for listening. If you've got any further questions about how this information applies to you specifically, please do book a telehealth video appointment with your usual doctor for that purpose.